Welcome to, or welcome back to, the Agatha May Detective Agency. I'm Agatha May, and in this episode, we're going to take a look at the Waccamaw Center for Mental Health. It's the facility where Mica Francis was involuntarily committed in February of this year. For brevity's sake, I'll be referring to it as Waccamaw Mental Health through this video, or sometimes just Waccamaw. Waccamaw Mental Health has been in operation since 1967, and is part of the South Carolina Department of Mental Health. And we all know what a stellar reputation a lot of state mental health facilities have, right? The center has grown over the years, has had a few recessions, but has managed to maintain itself despite having absolutely dismal reviews. And we'll get to some of those reviews here in a little bit. The first executive director at the clinic was James Pearson. James was the director from the opening of the clinic until his retirement in 1993. I didn't find much information on James Pearson, at least not anything scandalous. Boring. Wiley Blvd was director from 1993 until 2001, and he is a little spicier than old Jim. In 2014, Willie was convicted on 10 counts of Medicaid fraud that stemmed from activities in 2010. Murray Chesson followed Willie as the executive director and was there from 2001 until 2012. Unfortunately for our story, he's as exciting as a mayonnaise sandwich. Ethel Bellamy was the executive director from 2012 to 2019, and she at least has a few traffic violations on her record, but her last name is what caught my attention. You know who else is a Bellamy? The wife of Charles I Don't Beat My Wife Randall. That's right, none other than John Paul Miller's overseer and chief handler. Charles's wife wasn't the only Bellamy in his life either. His mother was a Bellamy too. I still haven't figured out if Charles and his wife were related before they got married, but at this point in the story, would it honestly be even slightly shocking? I also haven't been able to connect Ethel Bellamy directly to Charles or his wife, but the name is an interesting coincidence, right? Now, there are a ton of Bellamys in Horry County, though, so it's possible she isn't related to Charles at all. Jackie Brown became the executive director when Ethel retired, and she currently holds the position. Jackie is currently named in a lawsuit along with Ron Kreitz, who is an administrator at Waccamaw. The lawsuit was filed by a former employee who alleges that she was directed to fire an employee because the employee was pregnant. The claimant also alleges that she was directed to fire another employee who is in his late 60s because, according to her supervisors, he was too old. She refused to fire either employee and filed reports on her supervisors. Her employment was terminated soon after. South Carolina is an at-will state, which means they can fire you for any reason unless that reason is discriminatory. The lawsuit is ongoing. According to Waccamaw's dreadfully designed and maintained website, the clinic directors are Chloe Davis at Conway, Keisha Guest-Black at Georgetown, Winford Pendergrass at Kingstree, and Katrina Presley at South Strand. I don't know if any of the directors are still acting as counselors, but of the 5, I could only find a state license for one of them. All of the above have MPI numbers except for one. An MPI is used for providers when sending information such as insurance claims electronically. They are required for all HIPAA-covered entities. Please pause the video if you'd like to read the definition of an MPI that I blatantly pilfered from Google. If the clinic is billing under any of these directors' names, the director is required to have a state license. You know who else I couldn't find a state license for? Faith Green. She's the counselor who signed Mica's involuntary commitment affidavit. She claims that John Paul forced her to do it because he told her he wasn't leaving until she did. I don't accept that excuse. She could have called in a supervisor to handle it. Is it possible she was paid for the affidavit? Did she get one of those $350 benevolence fund checks? Was she threatened in some way? Faith does have an MPI number, so I wonder if the clinic is getting paid by insurance companies for her counseling, even though it looks as though legally she shouldn't have been counseling anyone. There's a question as to whether Faith actually witnessed Mica's actions prior to her commitment, or if she was just taking John Paul's word for it. If the story of John Paul cornering her until she agreed to sign the papers is true, she didn't witness Mica's behavior firsthand, which is a requirement for signing an involuntary commitment affidavit. I found other people on LinkedIn who have their current job listed as counselor at Waccamaw Mental Health. I realize that there are people who don't update their LinkedIn, but after just a brief search, I came across 6 others who were listed as counselors that I couldn't find a state counselor's license for, nor could I find a license for them as a social worker or a psychologist. I came across more alleged employees at Waccamaw without a state license than I did those with a license. I attempted to find the current board members for Waccamaw Mental Health, but since their website is so horribly maintained, I'm not sure if this is up to date or not. But 2 people that are listed as board members are interesting. One is Reverend Dorothy Katrina Reeves. Well, guess whose Bible college the good Reverend attended? That's right, our old barmy pal, Reginald Wayne Miller's college. I'm sure that's just a coincidence, though. She's also Facebook friends with a lot of the Randalls and Bellamys. The other person listed on the board that I found interesting is Carolyn Hickman Williams. She's also friends with a lot of Bellamys, as well as Livingstons, which is another name in the Randall-Bellamy family. I'm unsure of how close these board members are to Charles Randall and his family, but it's another funny coincidence. Speaking of his family, Versie Bellamy is the Deputy Director of the Division of Inpatient Services at the South Carolina Department of Mental Health. She's pretty high up in the chain of command. When I first started this channel, I made a couple of videos about Charles Randall. In one, I discussed how he's related to Margie Bellamy Livingston, who is an Horry County magistrate judge. From what I've researched, it looks like Versie Bellamy is related to Judge Margie, and so somehow related to Charles Randall. That's just another coincidence, right? And there was another Livingston who's related to the Randalls and Bellamys that was working at the Conway Waccamaw Clinic. Her name is Kimberly Livingston, and she was an employment specialist from November 2016 to June of 2024. Her LinkedIn shows that she's self-employed now. I wonder why she left the clinic in June of this year. She's probably just another coincidence, though. And not to sound like a broken record, and I'm sure it's just a coincidence, but there's another friend of the Bellamys and Livingstons that's listed as a counselor at Waccamaw. On her LinkedIn profile, Constant Busby shows that she's been a counselor there from 1994 to the present time. Maybe she just hasn't updated it. I couldn't find a state license for her either. Let me say again that I do realize that there are a lot of Randalls, Bellamys, Livingstons in Horry County, but there seems to be more than a few that I've found connected to Waccamaw Mental Health. You know who else has worked at Waccamaw that I'm sure is just another coincidence? Charles Randall's daughter, Vanita Randall. She also goes by her middle name, Catrice. I don't know if she's still working at Waccamaw, but as of 2023, she was still on the payroll for the South Carolina Department of Health. Vanita was named in a lawsuit in 2020 when the family of a patient sued the State Department of Mental Health. 2 patients were being transported between facilities, and Vanita was named as the person who approved the transfer. There was flooding occurring at this time from Hurricane Florence. 2 deputies picked up the patients, put them in the back of a van, inside a cage where they were shackled and locked in. The driver of the van drove around a road barricade that was up because of the flooding. The van ended up getting stuck in the water, and the 2 patients in the back drowned because the deputies didn't have a key to unlock the cage. Since Vanita was employed by the state, she was protected from the lawsuit by the South Carolina Tort Claims Act. Please don't ask me to explain what that is because I hate reading legal documents. All I know is that it protects state workers. I'm starting to think that when Waccamaw Mental Health has its annual employee picnic, it could also double as a Randall, Bellamy, Livingston family reunion. Does it seem like Charles Randall is like a little prairie dog that just keeps popping his head out of the ground? Every time we turn around, there he is. Until I saw the video of him at the court settlement, I didn't realize how small he actually is. He's a tiny thing. If I didn't have such a strong aversion to him, I'd put him in my pocket and take him home. So about those patient reviews I mentioned earlier. 118 people have reviewed them on Google, and they have a rating of 1.8 out of 5 stars. Of the 118 reviews, only 23 are rated 3 stars or more. And of the remaining reviews, only 6 are 2 stars, and the rest are 1-star reviews. Oh my. So let's see what some patients have to say. Susan wrote, "The Myrtle Beach office front staff and office manager are extremely rude. Also, the right hand doesn't know what the left hand is doing, and it's painfully clear." Jennifer wrote, "They never know what's going on and is no help. Their staff needs to seek mental help sometimes. They never want to listen to the parents, and they like to blame the parents for everything." Dana wrote, "Had my intake there recently and probably will not return. Most people do not like their information publicly announced, especially HIPAA binding info. So when you check in, they make you state your full name and address. They refuse to take my ID. They will make someone more uncomfortable in an already uncomfortable place." Marshall wrote, "No courtesy, horrendous service. Drove over an hour this morning for my appointment, which was set up through another doctor's office, not directly by me, the patient, only to be told that they could not see me because they were short-staffed. No notice of this whatsoever prior to my appointment. Only reason they get 1 star is because 0 stars is not an option." Katie wrote, "Absolutely awful place. I pray no one has to admit themselves here. The workers do not care about anyone. All the workers here truly need to think about how they want to live their life. It makes no sense why everyone that works at this facility is disrespectful and not one person has one speck of humanity in their hearts." Anonymous wrote, "Terrible place. No wonder why they're on a therapist shortage. Multiple therapist reassignments, cancellations without any notice, and they give your appointments away without any particular reason. The doctors are mainly just speaking to a computer in a scheduled room. Most of the time, it's Medicaid until they shut up." A different Susan wrote, "This place should be shut down. After 2 weeks of trying to get an appointment, endless phone calls, and driving to the office for an intake, nothing has happened. They have lost all my daughter's paperwork. Great HIPAA practice there. Front desk clerks totally threatened me, not 1, not 2, but 3. I could go on and on. I will be reporting to the medical board. I will not stop until they are handled. Look at all the ratings." That review was from 7 years ago, and it doesn't sound like the clinics have improved. Natalie wrote, "Dr. Duchesne fell asleep during 2 of my face-to-face visits. How in the world is this woman allowed to prescribe medicine? What a joke. I didn't even bother waking her up. I've never felt more uncomfortable in my entire life. She blamed it on her allergy medication, as she had a big cup of coffee in her hand. Unbelievable." In the photos of the medicine bottles that John Paul provided as being Mica's, one of them had Dr. Duchesne's name on it as the prescribing physician. And our final reviewer, Army Mom, wrote, "The needs of their patients aren't properly addressed. They do just enough to get government funding." I'm beginning to think that Army Mom might just be right. So why did DeLorean driving John Paul Miller, who has over $6 million in assets, I know they're technically in the church's name, but he owns the church, why did he decide that Waccamaw Mental Health was the best place to take his wife? It's definitely not for the stellar care or luxurious accommodations. From looking at documents he provided with the affidavit, it seems as though John Paul and Mica didn't have insurance. Why wouldn't the church provide insurance for them? Did John Paul take her to Waccamaw so he could try to lie about their finances and get her treatment at a lower cost? Or was there another reason he took her there? A reason that has more to do with knowing someone who might be related to a lot of people who are employed by the Department of Mental Health, both at the Waccamaw facilities and at the state administrative level. Are the directors and supervisors at Waccamaw hiding discriminatory employment practices? Are all of their counselors licensed by the state as required? Is there any insurance fraud happening? Are they providing quality care to their patients, or are they only doing just enough to get by? Patients who are uninsured or underinsured or simply don't have money to pay for private mental health care have to rely on places like Waccamaw Mental Health. Why are they not worthy of getting the same treatment as someone with insurance? We have to do better for the vulnerable citizens in our country. And those of us who can have to start speaking up for those who cannot speak up for themselves. We can't allow what happened to Mica to keep happening. We need government agencies to become the standard of care, not be the facilities where the poor are medicated, shoved in the corner, and denied their voice. I would love to tell you what the next video is going to be about, but I have no idea. I'll be back soon with something, though. Thanks so much for watching. Until next time, stay safe and be happy.